Welcome back, everyone, to today's health analysis segment. We're stepping into a space of absolute clarity today, bringing a really professional, close-up look at a topic that touches pretty much all of us as we navigate life after 50. This explainer is all about vitamin safety. You know, getting older doesn't mean we have to live in a state of constant worry about our health. Actually, it's the exact opposite. It's a great invitation to make really informed, careful, and empowered decisions. So we're going to unpack the hidden complexities of some incredibly common vitamins, completely stripping away the sensationalism you see online and focusing purely on the actual science of how these supplements interact with our bodies. Picture your typical morning. You know the one. Warm sunlight is streaming through the kitchen window, the coffee's freshly brewed, and right there, next to your breakfast plate, is your daily handful of vitamins. It's such a familiar, comforting scene for so many of us, right? Just a simple, daily ritual meant to protect our health. But I have a pretty crucial question for you. Are those morning vitamins actually safe? We tend to view over-the-counter supplements as universally beneficial, or at worst, totally harmless. But as we're going to see today, when our bodies age, and especially when we mix in other prescription medications, that cozy morning routine requires a bit more scrutiny. All right, let's get right into part one, niacin and its unexpected risks. This is a classic case of when good vitamins can actually do harm. So niacin, you've probably heard of it as vitamin B3. Now, let's be clear, it is not inherently a bad vitamin. In the normal doses you'd find in a good meal or a standard daily multivitamin, it's a completely necessary nutrient that your body absolutely relies on. Historically, doctors even used it to help improve cholesterol levels, but medical science has evolved quite a bit. Today, we have much more effective and far safer prescription medications to manage cholesterol. Because of that, niacin just isn't widely prescribed for that purpose anymore. The real danger kicks in when people decide to take it upon themselves to consume high-dose niacin supplements without any medical supervision whatsoever. Because taking huge, unsupervised doses of this stuff, well, it can set off a massive chain reaction in your body. People often experience this severe facial flushing, or a sudden, really intense feeling of heat radiating through their whole body, accompanied by severe itching. It literally feels like a massive hot flash. But the risks go way deeper than just feeling uncomfortable. For older adults, especially those managing existing health conditions, high-dose niacin can totally disrupt your blood sugar control, negatively impact your liver function, and even spike your uric acid levels. If you're someone already juggling things like diabetes, gout, or liver disease, throwing high doses of this vitamin into the mix is, well, it's basically like throwing a wrench into a finely tuned engine. Let's put a face to this and look at a real-world scenario. Think about Margaret. She's 69 years old, super active, and really cares about her health. Like a lot of us, Margaret spends time reading health articles online. Recently, she stumbled across this trendy post claiming that high-dose niacin could miraculously clean out blood vessels. I mean, it sounded fantastic. So, wanting to be proactive, she bypassed her doctor entirely, went straight to the local pharmacy, bought a high-dose niacin supplement, and just casually added it to her morning routine. Well, fast forward just a few weeks, and Margaret's daily life was turned completely upside down. She started experiencing that severe facial flushing and these awful waves of heat that made her feel like she was running a high fever. Even more alarmingly, and this is the scary part, she suddenly found it incredibly difficult to control her blood sugar, which was something she had always managed perfectly well before. When she finally went to her doctor, they figured out she was taking massive doses of niacin alongside her other daily supplements. So the crucial point here is this: niacin isn't a poison, but this proves that even everyday vitamins must be used for the right person, at the exact right dose, and for a scientifically valid reason. Okay, moving on to part two, folic acid and the masking effect. We're talking about the very real danger of hidden deficiencies here. Now, folic acid, or vitamin B9, is absolutely vital for blood creation and healthy cell growth. But it has this hidden characteristic that brilliantly illustrates just how delicate the balancing act within our bodies really is. Over on the left side of your screen, you can see that high doses of folic acid can actually improve the symptoms of anemia. That sounds great, right? But look at the right side. If a person is secretly suffering from a vitamin B12 deficiency, taking high doses of folic acid will artificially improve their blood work. It makes the anemia look like it's completely cured, but in reality, it's acting as a mask. While the blood looks fantastic on paper, the severe and progressive nerve damage caused by the lack of B12 is just continuing silently in the background. By the time that B12 deficiency is finally discovered, the neurological damage might be severe. And this masking effect is precisely why we have to identify who is most at risk. Look, as we age, our bodies naturally become a bit less efficient at absorbing vitamin B12 from our food. It just happens. This risk absolutely skyrockets for older adults who might have a poor diet, anyone who has had previous stomach or intestinal surgeries, or those taking certain common medications that literally block B12 absorption. Everything in your body is connected. This clinical reality is exactly why a responsible doctor will almost always check your vitamin B12 levels first, before ever recommending a high-dose folic acid supplement. Which brings us nicely to part 3, the 5 rules for safe use, all about taking control of your health after 50. Look, we've looked at the cautionary tales of niacin and folic acid, but the goal of this explainer is absolutely not to make you fearful of your medicine cabinet. It's to empower you. So let's shift gears to rule number 1. Don't copy others. We all have that friend or relative who swears by a specific new supplement, right? They're always telling you how much energy it gives them. It is so tempting to just go buy the exact same bottle. But your body is a totally unique ecosystem. What works wonders for your neighbor's biochemistry could severely interact with your specific blood pressure medication or your unique health history. Health is highly individualized, guys. Never borrow someone else's routine. Rule number 2 addresses an invisible trap sitting right there on your kitchen counter. You must read every single ingredient label carefully. A lot of older adults take a multivitamin, plus a joint supplement, plus maybe a heart health gummy. Without even realizing it, 3 or 4 of those different products might all contain vitamin D or vitamin B6. You could literally be taking 4 times the recommended daily limit of a specific vitamin by accident simply because you didn't realize it was overlapping across all your different bottles. Okay, rule 3, total transparency with your doctor. You need to tell your healthcare provider about all the vitamins and supplements you take, no matter how natural or harmless you think they are. This is incredibly critical if you are managing chronic conditions like diabetes, heart disease, kidney issues, or liver disease. Listen, over-the-counter supplements act chemically just like prescription medications inside your body. To your doctor, they are crucial pieces of your health puzzle. Sometimes knowing about a quote-unquote harmless daily vitamin is the exact missing clue a doctor needs to understand why your blood pressure is fluctuating. Moving to rule 4, and it brings us right back to basics. Prioritize food whenever possible. Pills are meant to supplement a diet, not replace it entirely. Picture a diverse, colorful plate. Leafy greens, whole grains, maybe some nice legumes, and high-quality proteins like fish. That beautiful meal provides a complex matrix of nutrition that a lab-made pill simply cannot replicate. Whole foods don't just give you isolated vitamins, they deliver essential dietary fiber and countless natural, beneficial compounds that all work together perfectly to keep your body thriving. And finally, rule number 5, don't guess, get tested. We live in an era of incredibly advanced medicine. There is absolutely no need to rely on gut feelings or targeted internet ads to decide what your body is lacking. If you're feeling fatigued or if you're just wondering if you need more vitamin D during the winter months, empower yourself. Ask your doctor for a simple blood test. Let the actual hard data from your own body dictate what you need rather than a clever marketing campaign. As we wrap up today's explainer, I really want you to reflect on a fundamental truth. Every health decision should be based on understanding, not trends. Aging brings this beautiful wealth of wisdom, and that wisdom should definitely be applied to how we care for ourselves. We don't need to chase the latest internet fad. We just need to understand our own bodies, rely on sound science, and partner really closely with our medical professionals. Which leaves us with one final provocative thought to carry with you long after this segment ends. Tomorrow morning, when you are looking at your daily supplements, I want you to ask yourself, do you truly know what you are taking today and exactly why you are taking it? I highly encourage you to take just 5 minutes to review your labels and maybe even bring those bottles to your next doctor's appointment. If you found this breakdown valuable, please make sure to subscribe to this series so you don't miss our future health explainers, where we'll keep transforming complex medical science into clear, actionable knowledge. Thanks so much for joining me today, and stay healthy.